This is not a conspiracy theory. This is documented history. The story of how the sugar industry bought the science of nutrition, and why you're still paying for it with your health. In the aftermath of World War II, heart disease was rising rapidly in America. Scientists were scrambling to find an explanation. Two men emerged with competing theories. One would destroy the other, and reshape the eating habits of billions of people for over 6 decades. Ancel Keys was a physiologist at the University of Minnesota. Driven, charismatic, and politically powerful. In 1958, he launched what became known as the 7 Countries Study, the most influential nutrition study of the 20th century. It was also one of the most scientifically dishonest. His hypothesis: saturated fat and dietary cholesterol caused coronary heart disease. Keys gathered data from 22 countries. But when his own data failed to support his theory in many of them, France, Germany, Chile, Finland, he simply removed them from the analysis. He published only the 7 countries that matched his predetermined conclusion. France and Germany had high fat consumption and low heart disease. That data was buried. This is not how science works. This is how science is corrupted. There was someone who saw through it. Dr. John Yudkin, a British nutritionist at Queen Elizabeth College, had already identified sugar as the real culprit in heart disease. In 1972, he published his groundbreaking book, Pure White and Deadly. Keys used every weapon at his disposal to destroy Yudkin's credibility. He called his work a mountain of nonsense. He pressured journals not to publish him. And it worked. Yudkin's career was effectively ended. His findings were buried for 30 years. In 2016, documents discovered by researchers at the University of California, San Francisco revealed what they called Project 226, a covert operation by the Sugar Research Foundation, now known as the Sugar Association. In 1965, they paid Harvard scientists $6,500, equivalent to over $60,000 today, to write a literature review that would shift the public narrative from sugar to fat. Big Sugar paid Harvard, and Harvard complied. Dr. D. Mark Hegsted and Dr. Frederick Stare, from Harvard's Department of Nutrition, accepted the payment. The Sugar Research Foundation handpicked which studies they would review and oversaw their drafts. The scientists signed off on conclusions they were paid to reach. In 1967, the review was published in the New England Journal of Medicine, the world's most prestigious medical journal. There was no requirement to disclose corporate funding. The consequences of the 1977 guidelines were catastrophic and global. Dr. Hegsted, one of the paid Harvard scientists, directly helped write those guidelines. They instructed Americans and ultimately the world to reduce saturated fat and increase carbohydrate consumption. The food industry reformulated thousands of products, removing fat and replacing it with sugar. Low-fat yogurt, fat-free cookies, heart-healthy cereals packed with refined carbohydrates. And people got sicker. What followed was not an accident. Metabolic disease rates accelerated sharply after 1977, precisely when the corrupted guidelines took effect worldwide. The graph tells the story that the guidelines never did, an explosive upward trend that began the moment high-carb eating became official global policy. Today, 537 million adults have diabetes worldwide, triple the rate of 1980. 1.9 billion adults are overweight or obese. Heart disease remains the #1 cause of death globally, despite 6 decades of low-fat dietary guidelines. And the corruption that caused all of this is now confirmed and documented. In 2016, the cover-up was finally exposed. UCSF researcher Dr. Kristen Kearns published her findings in JAMA Internal Medicine. She had discovered the original documents in a university archive. The paper confirmed that the Sugar Research Foundation had systematically and deliberately corrupted the science of nutrition. Dr. Kearns described it as, and I quote, a public health disaster driven not by accident but by design. The science that was suppressed is now re-emerging. Sugar and refined carbohydrates drive insulin resistance, the root cause of type 2 diabetes, obesity, and cardiovascular disease. Saturated fat from whole food sources does not independently cause heart disease in most people. Dietary cholesterol does not significantly raise blood cholesterol for the majority of individuals. Eggs, meat, butter, and natural animal fats are metabolically supportive. The food pyramid was never based on health. It was built on industry money. Your body is not broken. The system that was supposed to protect it was corrupted by financial interests. The first step is understanding what actually happened, and that starts with questioning every guideline that shaped every meal you were taught to eat. The architecture of your metabolic health can be rebuilt. But first, you have to know what broke it. Question everything you were taught. Your metabolic crisis was not your fault. It was engineered by people who profited from your illness. Follow the money, then reclaim what was taken from you.